అంటే అక్కేమో D3 టాబ్లెట్ వాడమన్నారు. విటమిన్ అయోడిన్ వాడామమ్మా.
మీరు
ఫిష్ ఆయిల్
సాక్ష్యం
వాడామమ్మా.
చెప్పండి బ్రదర్. సప్లిమెంట్స్ కాదండి. సప్లిమెంట్స్ ఏది
అమ్మమ్మ
వాడారో కాదు, సాక్ష్యం చెప్పండి.
అమ్మ ఇవి వాడిన నుంచి అక్క టెస్ట్ చేయమన్న తర్వాత అక్క ప్రిస్క్రిప్షన్ ప్రకారం వాడామమ్మా. వాడిన తర్వాత ఏమో బాబు రోజుకి 5 అవర్స్ పడుకునేవాడు, ఇప్పుడు 8 అవర్స్ పడుకుంటున్నామ్మా. వెయిట్ లాస్ అయితే బాగానే తగ్గిందమ్మా, పర్లే బాగానే ఉన్నాడమ్మా. వెయిట్ లాస్ ఒక 4-5 కేజీలు తగ్గాడమ్మా. 20 days అవుతుందమ్మా వాడి. బాబు పడుకుంటాడు కొద్దిగా. అంటే వీడికి ఆటిజం ఉందమ్మా, ఆటిజం స్పెక్టర్. అక్క 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 యొక్క సలహాలతోనే ముందుకు వెళ్తున్నామమ్మా, బాగానే ఉంది ప్రస్తుతానికి. అయితే వీడికి పాస్ప్రస్ కొద్దిగా ఎక్కువ ఉందమ్మా. దాన్ని బట్టి వీడికి పారాథైరాయిడ్ హార్మోన్ ఏమో ఒకటి పెంచమన్నారు డాక్టర్ గారు.
ఒకసారి ఆగండి సత్యనారాయణ గారు. ఎన్ని
సార్
రోజులు అవుతుంది బాబు ఇవన్నీ ఇవ్వడం మొదలెట్టి? ఎన్ని రోజులు అయింది? ఫస్ట్ ఆఫ్ ఆల్ టుడే ఈజ్ అన్ ఇంగ్లీష్ సెషన్. సో మీరు ఒకవేళ తెలుగులో చెప్పాలనుకుంటే కనుక రేపు అంటే తెలుగు సెషన్ అప్పుడు చెప్తే బాగుంటుంది. టుడే ఈజ్ ఇంగ్లీష్ సెషన్. సో వీ విల్ కండక్ట్ దిస్ whole session in English. But yeah, since you already started, we will continue. So మీరు ఎంతకాలం అయింది స్టార్ట్ చేసి? హలో,
25 days అవుతుంది సార్.
25 days అయింది. ఓకే.
అవును సార్.
ఇంకొకటి ఏంటంటే మీరు ప్రిస్క్రిప్షను ఇప్పుడు ఇక్కడ ఉన్న వాళ్ళు ఎవరు ప్రిస్క్రిప్షన్స్ ఇవ్వరు. ఉమాప్రకాష్ గారు
అవును సార్.
ప్రిస్క్రిప్షన్ అన్నారు, అది ప్రిస్క్రిప్షన్ కాదు. మీరు
అదే
మాట్లాడే మాటలు కొంచెం జాగ్రత్తగా చెప్తే
సారీ
బాగుంటుంది. ఎందుకంటే
సారీ
చాలా
సార్, నాకు
కన్ఫ్యూజన్కి
తెలియదు.
అందరూ చాలా
అవును
కన్ఫ్యూజన్కి గురయ్యే అవకాశం ఉంది. ప్రిస్క్రిప్షన్లు
అవును సార్.
కాదు, ఏమీ కాదు. ఇవన్నీ కూడా నేను మొదటి నుంచి చెప్తున్న ప్రకారం ఇవన్నీ మీ యొక్క బాడీ న్యూట్రిషనల్ నీడ్స్ని, అంటే మన పోషకాహారం సరిగ్గా తీసుకోవడం వలన వచ్చే అంటే పర్యవసానాలు ఇవన్నీ. సో దాన్ని అంటే మంచి చేంజెస్ ఇవన్నీ. సో యా, జాగ్రత్తగా చెప్దాం. మరి ఇంకొకసారి ఇంకొక రోజు మీరు తెలుగులో చెప్తురు కానీ వీ విల్ కంటిన్యూ దిస్ సెషన్ ఇన్ ఇంగ్లీష్. ఓకే, థ్యాంక్ యూ అండి. థ్యాంక్ యూ. Yeah, thank you so much for joining once again. I think today, as promised, yesterday, we will talk about insulin resistance. Before talking about insulin resistance, what I'd like to do is I'd like to set some expectations here. Okay, so it is like many people are thinking that this is a platform where you come here with all your problems, okay, emotional, physical, health problems, and all those things, and suddenly we assign you a health coach, and all your problems will go away. That's not what you should be expecting. Okay. See, this is a self-help platform, okay, educational platform. Okay, what we are here for is to educate you on how all the things that we have forgotten. Okay, so we used to know about all these things instinctively a generation ago. In our parents' generation, in our grandparents' generation, all these things were most of the dietary patterns are known instinctively, but because of so many changes that happened in the recent times, we have forgotten those. I think we have gotten accustomed to if we have illness, we go to the doctor, and doctor will give us a tablet, and that tablet will fix everything. And many people are coming to this platform with the similar expectations. Okay, and that is going to place a humongous burden on us, and we are not set up to run this like a clinic, not a hospital. See, and also this is not a replacement, or this is not a alternative to your doctor. It is not. Okay, please, you need to understand that. Okay, and yes, some of the problems we are able to address. Some problems like cancer, on which the medical establishment has given up on. Those things we are addressing as our time permits. But most of the issues, if you have pains, if you have issues, yes, those can be addressed, and those with proper corrections, those will eventually be resolved. And we are confident of that. I think in 90 plus percent of the cases, those things can be resolved. Okay. So this platform exists to teach you the things that we have forgotten, okay, and things that we used to know, the society used to know. I think now we have completely, I think, forgotten, and those are the things that we are here to enlighten you on and educate you on. Okay. And slowly but surely, with 1 month, 2 months, and 3, 4 months of learning these new things, okay, you suddenly you will notice that you're feeling a lot better. Okay, your body is functioning as it is supposed to. Okay, and you are not, your children are not getting infections like they used to. Okay, and where I think many testimonies we have heard that many of the children that were going to that they needed to be taken to the doctor or the clinic almost every month. Now, after joining here and following the recommendations in the past 5, 6, 7, 10 years, no, 5 years, not 10 years, but 5.5 years, 3, 4, 5 years, they have not, they did not need to go to a doctor. Okay, because if we do not become sick, there is no need, correct? So, um, those are the things that we are after. So those are the things that you can expect. Okay, but the things that we cannot bear the burden of is, if you bring all your issues, and yes, there are so many issues. I think we can sympathize with you on those, but this is a team effort. Okay, your doctor is part of the team, and we are part of the team, and you yourself are part of the team. So you are part of the team. Okay, so the thing is, we cannot cut out any of these parts. Okay, so do not give up on your doctor, and if you have issues, please go consult your doctor and let us know what they said, and let us know the diagnosis, and let us know about their reports. Okay, and nobody will tell you, your doctor will not tell you about proper nutrition, what proper nutrition is. Okay, and you are coming here for that. Okay, and also vitamin D correction, and there are many misconceptions about vitamin D correction in the medical establishment, and we are here to enlighten you on those issues, and also with proper diet, what the proper diet is, and what would be beneficial for you, and how what diet would lead you down the path of sickness. Okay, so what to avoid. Okay, and those are the things that we are here to tell you and educate you. And also, there are so many lifestyle changes that have happened over the past 2 or 3 decades, because I think India used to be a decidedly slower paced society, but now it is competing with the developed world. So it's so much so that people have become sedentary, and they are pursuing careers that require you to sit in front of a screen almost all day, and also in artificial lighting almost all day. And some people are working the night shifts, and the shift work is very dangerous for your health. So these are the things that we are here to educate you on. So those are the expectations that you should be having. Okay, instead of coming to us, and whenever something serious happens, whenever you have a headache, whenever you have these things, those are the things we are not equipped to deal with. And also, we are underemphasizing the health coaches now, because this has become a very burdensome thing even for them, because if you bring every simple problem to them, if you have a little ache, little pain, and little indigestion, if you bring it to them, it is impossible for them to address these things. Okay, you're not able to talk to your doctor about these things, and how can you expect somebody who have their family needs to take care of with all these things. So the emotional things, and yes, we can understand, we can appreciate what you're going through, but these are there are limitations to this platform also. Okay, so the limitations are, we are not a clinic, we are not a hospital, and we are not your doctor's office. Okay, but what we are is we are filling a gap of knowledge, which nobody will tell you as to your lifestyle, what modifications will benefit you in your lifestyle, and what a diet and that we are used to, if it is detrimental to you, if it is beneficial to you, we are here to tell you that. And also, and agricultural chemicals, and also endocrine disrupting chemicals, all these chemicals that we are getting exposed to on a daily basis, how that is affecting our system, that we definitely need to address that. And also, there are critical deficiencies in vitamins. They can give rise to disease process that we need to you all need to know. Okay, and those things we will be diligent to bring to you on a daily basis. Okay, so please join this platform. And also, one more thing is, if there is anybody who is guiding anyone at all, please, you must join this platform on a regular basis. If you're not joining on a regular basis, you cannot, I understand you probably would have recovered from our previous recommendations. You cannot just simply take those recommendations blindly and apply it to everyone else. And that is not allowed. And that cannot help. Sometimes that may not help the person, because this is not a boilerplate approach to fixing somebody's nutrition. It is an individualized approach. Okay, so that is what this platform is about. Okay, and you must understand this. And with that introduction, and also, if there is anybody who is guiding you, make sure that they attend this forum on a regular basis, because so that they can keep their knowledge up to date. And also, once you are you're able to address your family's issues and your problems, we want you to learn simultaneously, and so that you can take care of your own problems in the days to come. Okay, so next year, sometimes what we keep hearing is, yes, we followed your recommendations during COVID times, and we have benefited a great deal, but now help us this way. And if see, during COVID time, I have instructed many people on the importance of maintaining vitamin D levels, and without understanding that, so people are coming to us and asking us for help, and their vitamin D levels are in teens and in single digits. Okay, so if you cannot understand, about 2 years ago, 4 years ago, and when you have recovered from COVID, and that is when you understood, hopefully you understood the importance of vitamin D, and now you're coming back here again 2 years later and saying that your vitamin D is in teens, and you are vitamin D deficient again. So that is, you're learning the things that you have learned before, again and again and again. And that is that is not fair for people who are guiding you, and that is not fair for me also, because if I have to address the same problems that I have addressed about 2 years ago, and that is we are those are the limitations that we have. We are not able to deal with those. Okay, you need to learn. Okay, you need to learn. All the knowledge is being made available to you, and you must, and you need to learn. And this is about your health. Okay, this is not about about our name or our fame, or it's not about anything else, but it is about your health. So you are responsible. Okay. And you need to understand nobody will take responsibility for your health. Nobody can. And we are not able to. And even your doctor cannot. Okay. Because, if you go to the hospital, they will make you sign so many waivers and so many disclaimers and so many releases before they lay a hand on you. So they'll tell you, we are not responsible if something were to happen to you during this procedure, right? You sign those releases. Okay. And so because you are assuming that responsibility, even here, okay, when you choose to take these recommendations, you are accepting that responsibility, because that is the responsible thing to do. Okay, so you need to learn. You need to learn, and you need to pass on this knowledge to many. And that is the reason why being able to learn, being able to listen to the information that is being presented on a daily basis is extremely important. And you can learn continuously. See, if I'm spending about an hour and a half on a daily basis every day, and what excuse do you have? It is about your health. It is not, and I'm not going to gain anything from this, right? Okay. So that's with that. I think if it sounds harsh, yeah, it is. But it is for us, for this platform to be a benefit to many. I think these changes are necessary, and this understanding is of paramount importance. Okay, thank you so much. Okay, so I think we are almost at the end of my time here, but we will just address some of the things, and I'm not going to be able to do justice if I start insulin resistance now. But what I will do is how to implement our recommendations. Okay, so the first thing that we do is when anybody comes, okay, first thing that we do is we ask you to get your vitamin D level checked. Okay, and the second, vitamin D level, and also for adults, what we ask you is vitamin D and HbA1c and insulin, fasting insulin level. Okay, these three things tell us where you are metabolically. And also, if you have a CBC, complete blood count, complete blood picture, that will help us as well, and also your lipid profile will help us, because if you have, if your triglyceride levels are high, that points to you being insulin resistant. Okay, so there are some terms that you absolutely positively must understand. Vitamin D deficiency is one of them. Okay, if your vitamin D level is in single digits or double digits or in teens, then you are fighting a battle. See, with every illness, you are fighting a battle that you cannot win. It is impossible to win. So, and also most of the time, what happens is, if you go to the hospital or a doctor's office with illness, the first thing that they do is to put you on antibiotics and steroids. Okay, and sometimes you probably may need those, but not all the time. So every time, if you go with a cough or cold, you are put on antibiotics, and that is affecting you. So those antibiotics are affecting you. But do not see, because I'm saying this, do not stop. If your doctor thinks you need antibiotics, do not stop them. But what I want you to do is gain an understanding of how your body functions. Okay, so let's go back to the test that we asked you to do. So vitamin D test. Okay, if your vitamin D is in teens or single digits, you are fighting a battle that you cannot win. So that's what I said, right? So if there is infection, see, in every infectious process, vitamin D deficiency plays an extremely important role. And if you are vitamin D sufficient, you are that much more ahead, because some people get affected with infections to a greater degree than others. That is because if their vitamin D levels are proper, the vitamin D is helping you fight off this infection, because that is empowering your immune system, okay, to fight off these invading organisms. Okay, vitamin D is important. Not only that, not only it is an immune modulator, it is a gene expression modulator, and also it directly works against some of these some of the pathogens, and vitamin D is very vitally important with how your endothelium and epithelium and your blood vessels and how they function. Okay, and how your intestinal system functions, because vitamin D, it improves the integrity of the tight junctions of all these layers. Okay, so vitamin D is crucially important, and it is very critical, and it is absolutely imperative that we correct your vitamin D level first. Without correcting vitamin D, and also many people are thinking, looking at listening to these testimonies, many people are thinking, oh yeah, if we add all these supplements, we will start experiencing the same results. No, that is not what we are saying, and that's not what we will say, because if you start adding supplements prematurely, you're throwing your money away. Okay, vitamin D levels are important. Okay, vitamin D correction is important. Yes, that is the reason why first of all, we correct your vitamin D levels, and then we start addressing your proper hydration. So along with vitamin D, your hydration is important. And hydration, without proper, your body properly being hydrated, you will be prone to many of the problems that that you are facing right now. Okay, so hydration is important, and how much water should you take? And sometimes, in hydration, mineral content is very important. So that is the reason why we put you on Supradine, that is a multi-mineral tablet, and also pink salt. Pink salt is extremely important, because if you do not take, if you're deficient in these minerals, and what happens is, you may take 10 bottles of water, and you can still be dehydrated. Okay, and this nasal congestion is one of the signs of dehydration. And also, if you're not properly hydrated, even vitamin D does not work properly. And also, many of the medications that you're taking, they do not work properly. Okay, so so the hydration, the second thing is hydration, and then the simple dietary changes. Okay, suddenly, I think so. Just now, ICMR came out and said people are not getting enough protein. Okay, none of the states in India you are getting enough protein. And also, there is a misconception that this millets and ragi and other things are helping you. But ICMR came out and said, there is no difference between the carbs that you get from rice and wheat and the carbs that you get from these millets and various other grains. Okay, and also they did address insulin resistance, and they did say that the usage of these millets and in various forms is contributing to insulin resistance. That is what they said. It's not me. Okay, that's what they said. And also, there are so many popular channels promoting the use of these millets, and saying they are going to the extent of saying, as soon as you add these millets, and miraculous things will happen in your body, and you will start feeling a lot better. But we need to scientifically understand these things, not emotionally. See, the thing is, there is so much content on the internet which is designed to emotionally perturb us, and if we give into those things, and we will we probably will suffer because of that. Okay, so ICMR did say these things, and also protein. So, and we talked about protein extensively in the previous sessions, which were recorded. Okay, and none of us get enough protein. If you do not get enough protein, Okay, and many people come with a lot of issues, and you will start losing muscle. Okay, by age 30, now it is happening in even children. The sarcopenia, the age-related muscle loss, is even happening in very young children nowadays because of the lack of protein intake. So if you do not take protein properly, and so that correction needs to be made. Okay, but if you do not, the thing is, if you do not correct vitamin D, if you do not correct your the hydration, if you do not correct your minerals, the problem is, you probably may have a leaky gut and SIBO, or any number of these problems where everybody has gastric distress in India. So first of all, we need to address those. Okay, so then if you do not address those and you start adding this protein, you probably will suffer from bloating and allergic reactions and and indigestion and piles and all kinds of things. See, this years of irresponsible eating, whether you know it or not, is causing a lot of dysbiosis in your gut. Okay, that dysbiosis needs to be addressed. Okay, that is why we are correcting. So vitamin D correction, mineral correction, your hydration, and then and also first of all, your vagus nerve function is extremely important for your GI system and how our GI system works. Okay, if you are suffering from gastric issues, we need to fix your vagus nerve. Okay, how do we do that? Vitamin B1 plays an extremely important role in how your vagus nerve functions, and also in the nerve function, vitamin B1 is very important. That is the reason why we ask you to correct vitamin B1, that is thiamine, through injections and also supplementation through capsules, the benfotiamine. Okay, so as you do this, as you correct these things, you start feeling a lot better. You're moving a lot better, and you're exercising. You're able to walk, and what that does is it brings down your sugar levels, and also that brings down your insulin levels. Okay, and that improves the way your endothelium works, your epithelium works, and your blood vessels work, and your digestive system works. So once all these things start happening, then we slowly increase your protein level. So there is a method behind all this. Okay, if you start doing this out of order, you will not experience the benefits as many others have reported. Okay, so that is the reason why you need to come, and you need to attend these sessions on a regular basis. Okay, so I would not, it is 10 o'clock here already. So I'd like to end this by saying, okay, there is so much behind, maintaining our proper health. Okay, so all these things are simple things. Okay, but in all these things, in totality, that is going to have a wonderful impact, a greater impact on your health in time. Okay, so these corrections, after these corrections are made, and we monitor your progress, and because we can only monitor if you testify. You come here and testify and ask your questions, and then that is when you will be ready for, once these corrections are made, your dietary corrections, your lifestyle changes, and also exercise, and the vitamins and minerals and hydration. Once these corrections are made, then you are ready for the next level of corrections, that is your protein intake, and then the fat intake. So the high fat is not detrimental to your health. On the contrary, using proper fats is very helpful and very healthy. Okay. So all these things are so once we do those corrections, and we you start tolerating the protein and the eggs and the meat and bone broths and all those things, then we can go to the further the higher level, that is then we will know what supplements you will benefit from. Okay, so these are all the things that are imperative, that are and these things cannot be followed by giving you a list of things. Okay, so many people have asked me, give me a diet chart. I cannot. It is impossible. Okay, I cannot give you a diet chart that works for everybody. No. And also, give me a list of supplements that I'll start taking from tomorrow. No, that's not what we are about. And also, give me a list of links that of all the supplements. We cannot guarantee the quality of the supplements that people get. But if the quality suffers, what happens is you come back and say, we are using everything that you're suggesting, but we are not seeing any benefits. Our health has even worsened. Okay, I cannot. That is additional burden on me. Okay, so on us, on all of us. So that's So these are the things that we first of all let's do these corrections. And within 1, 2, or 3, 4 weeks, then we will assess and how you're feeling and how your glycemic control is. And many people are coming to us, even in their 30s, 40s, 50s, because their glycemic control is completely short, and they are not able to maintain their sugar levels at all, because even though they are taking insulin, even though they are taking diabetes medications, diabetic medications, they are not able to maintain their proper glucose levels. Why? Because that is the topic of I think next week. I don't think I'll be able to cover all these things this week, but I sincerely hope that you get the idea of what this platform is all about. Okay, so yes, there is a method behind all this. It's not like you come here and we give you supplements like your doctor gives you prescriptions, you go take them and you start feeling better. No, that's not how it works. Okay, and some of the supplements may not even work for you because you're not ready. Your body is not ready to accept them. Okay, so that is why it is important for you to attend these sessions. Okay, and also just if there are fertility issues, we have I think they should encourage you, because for the past 3.5 4 years we have 400 plus couples who have conceived. 400 plus. Okay, we have 400 babies to testify to the to the efficacy of this approach. Okay, so yes, there is hope, and it will not happen. And also the solution cannot be given, means it will not happen in a day or two. It is not possible. Okay, it takes time. Your body has developed all these dysfunctions. It became dysfunctional over a period of a decade or two. So all those things cannot be fixed in a day or two, because for the last 10, 15, 20 years you've been your body has been undergoing all these changes, and to bring it back to proper function, it takes time. Okay, so yeah, if you spend 2 decades, let's give it 2 more months. So please listen to these things and learn. And if you have any questions about the understanding the subject, please bring them up. I'll be glad to answer all of them. Okay, and thank you so very much. And yes, back to you, Sister Revati Bose. Thank you.
Yeah, Doctor, would you like to take up questions now?
Yeah, we can. Yeah.
Okay, so if any of you have any questions related to the topic that has been shared right now, you can raise your hand and Dr. Banu can answer the questions. Kindly do not come back for specific guidances here, but anything related to this topic that Dr. Banu has shared, you can go ahead and ask your questions.
Praise the Lord, sister.
Yes, sister.
I am Gunasundari from Srikakulam. This is the second day I am attending this meeting. Yesterday, on Saturday only, I got this information. So yesterday I joined in this meeting. Today is the second day. I have some health problem. Shall I share? I want to speak with the doctor, Brother Banagas.
Okay, sister, did you hear any of the things that I said for the past 30 plus minutes?
Yeah.
Okay. All right. And who directed you to us? Hello?
Sister,
Hello?
you are there, Sister Sundari?
Hello, brother, Pastor Narendra and Pastor Mohan.
Okay. Yeah. So this is not the time for specific questions about your health. But if you have any questions about what I presented, what I talked about, I'll be glad to answer those. But have you joined our WhatsApp group?
No, sir, they only yesterday I joined in this
Okay,
in this meeting.
that's fine. But do you have
today is the
yeah.
second day. I don't know anything about you one.
Okay. So there is a link that is posted here. Do you see the chat at the bottom of your screen? Sister, do you see the chat box at the bottom of your screen? Hello? Hello?
Sister Sundari, you are there?
Sister, why don't you share your number, okay? Share your phone number in the chat box, and somebody will contact you, okay?
Okay.
Can I ask a question
Wait.
related to the topic?
No,
Yes,
wait.
brother.
Let's
Yes,
just a minute. Hang on. Sister Sundari, are you here? Okay, that's fine. Yeah, go ahead.
Anna, I will take Sundari's number, Anna.
Yes, please. Yeah.
Yeah, praise Lord, Anna. Anna, if you are maintaining D3 level correction and maintain hydration, and after that mineral correction and intermittent fasting, eliminating all the processed food from our lifestyle. If you're maintaining all these things, is it okay? Parallelly, can we take the carbohydrates also as well? Because we can't eliminate as in Indians, we are easy to take the carbohydrates. If you are maintaining this, can we take parallelly for the
So first of all,
carbohydrates?
I think I have always said that if you are insulin sensitive, okay, if all these changes made you insulin sensitive, you're able to process sugars properly, yes, you can. But the thing is, taking carbohydrates means, see, in Indian context, it is, we do take excessive amounts of carbohydrates, okay? And that's not healthy. And if you start taking carbohydrates, and if you once you become insulin sensitive, to the same extent as you were used to taking, and you can become insulin resistant again. So you need to monitor where you are. So yeah, if you monitor and if you become insulin sensitive, yes, you can add carbohydrates to a reasonable degree, but not to the same extent as you were used to before.
Okay, Anna. Thank you, Anna.
And also we need to remember that most of these carbohydrates, they do have a lot of agricultural chemicals, and that can have a negative impact on our health. Okay, so we need to be cognizant of that as well.
Yeah. Now, for example, can we take the 2 idli with the more ghee? We can combine with the healthy
First
fats
of
with
all,
the carbohydrates.
let's not have that discussion. Yes, you can. Whenever you do take carbohydrates, it has to be tempered with a lot of ghee. That will cut down the insulin response quite a bit. Yes, you can. As long as you're insulin sensitive. But if you are in during this correction period, and your fasting insulin is, let's say, 20, 30 to that level, yeah, no, that would not be beneficial. But if your fasting insulin is below 5, and if you're exercising properly, if you're walking properly, yes, you can take two or three idlis. It's not a problem with as long as they are you take it with a lot of ghee. Yes.
Can I speak with one? I want to speak.
Thank you so much, Anna.
Thank you.
Brother, one question, brother.
Yes.
Yeah, brother. So I have insulin resistance 20, brother. When I started.
No. First of all, listen. No, let's not conflate the terms here. It is not insulin resistance. It is your fasting insulin level 20. Okay, go ahead.
Yeah. Yes, brother. Fasting insulin is 20. I started diet and I lost in last 1.5 months. I am doing the diet, brother. So I lost 6 kgs. I am at 83. Now I am at 77. And I'm still continuing. So how long it will take for that? Generally, how long it will take for that insulin resistance
See, first
to
of
come
all,
back?
no. See, the thing is, if you measure your fasting insulin level now, it would have come down, because if without it coming down, you could not have lost that weight. Okay, so insulin is a storage hormone, and insulin will not let you lose weight. Okay, that is the reason why many people, we are not eating much, and we are not eating anything at all, and they are eating carbohydrates, but they are eating less of it. But they are not because of this insulin fasting insulin being high, insulin levels in the body being high, that will not let anybody lose weight. So it is a good sign that you lost weight, and 6 kgs. That means this diet and your lifestyle changes have definitely worked in bringing down that insulin. So if you measure your insulin levels now, they would have come down considerably from that 20. Yeah.
Thank you, brother. Yeah.
And
I
also,
still need to continue.
these lifestyle changes, you need to continue. See, the thing is, if you want to be healthy, and if you want to be strong, if you want to maintain your muscle mass, and if you want to maintain your insulin sensitivity, if you want to maintain your circulatory and cardiovascular and cerebrovascular health, and peripheral and also your nerve health, yes, you have to continue this.
Thank you,
Brother,
brother.
good morning, Anna.
Okay, thank you.
Good morning, Anna. I am taking low carb diet. Whenever I am starting low carb diet, within 10 days I am getting amoebiasis. Can I help any? Can I get?
Okay, wait. Oksara, just a moment. Hang on. Okay, please, co-hosts, please make sure that nobody just unmutes and starts talking. And we don't want to listen to their conversations here. Okay, so amoebiasis. Okay, so have you taken a course for amoebiasis, Samson?
Brother, I have taken course for amoebiasis in the month of March.
Mhm.
After that, I stopped taking the low carb diet. Again, 15 days back, I have started low carb diet. Now I got again amoebiasis.
Amoebiasis is not a function of low carb diet. Amoebiasis is a function of contaminated water supply. Okay, so if you are getting exposed to contaminated water supply, or if the amoeba has not been eliminated from your system, that is probably what is causing it. Okay, so if you are getting exposure from contaminated water repeatedly, that is the one that's what will give you amoebiasis. But low carb diet will not. In fact, low carb diet will help you defend against such infections. And what is your vitamin D level now?
Recently, I did not check, but I am
Okay.
taking weekly one from the last 9 months. I am taking.
Okay, then you need to get your vitamin D level checked. Okay, so that may or may not be enough for you. So let's get it checked. Okay.
Okay, thank you.
Okay, thank you.
Brother, after doing all these things, what will be the ideal time to check the progress of vitamin D test?
So once you come to the maintenance dose, wait for 2 or 3 months and then get it checked.
Okay, thank you.
Okay.
It's Sister Pramila.
Good morning, brother.
Yes,
Praise
go
Lord.
ahead. Praise the Lord.
I've joined this in the past 3 weeks, brother, and I'm listening to your videos, and they're very informative. Thank you, brother. But one question I have, that my kids are in hostel, brother. After listening these sessions, I came to know that they mostly they frequently get ill due to flu, cough, and cold. So vitamin D is the main cause for that. So how to deal with kids who are in hostel, brother? Please suggest me.
Whether they are in the hostel or whether they are home, nutrition is very important. So I don't even know how to address this because just a moment, hang on. Even when they are in the hostel, you have to find a way for them to eat properly, nutritious food, and also the vitamin D levels. Even in children, if they are vitamin D deficient, it can be very with respect to repeated infections that can be that can affect them negatively. Okay, so you need to find a way to whatever you are learning, even in the context of a hostel, you should be able to come up with creative ways to maintain their levels. Okay.
Okay, brother. Thank you, brother.
Thank you.
Brother Kiran.
Praise the Lord, brother. This is Kiran here. I have one question in general. I know I live in US. I've been using the purified water. So, what's your take on switching to alkaline or spring water?
Purified water. How are you purifying the water?
I use Sam's Club packs. We use the bottled water.
See, most of the Sam's Club water probably is mineralized. Okay. So check with that, and also, but if you have a filter at home, a reverse osmosis filter at home, you can buy a mineralizing filter, mineral filter. After the last carbon filter, you can install a filter which adds required minerals to your water. Okay. But check if your Sam's Club water is remineralized or if it is run through the mineral filter.
Okay, brother. I'll
Okay.
check. But in general, what do you say, like alkaline water with pH level high?
You know what? Listen. I think we've been through this this question before. See, our body has a way of maintaining proper pH. Even if you take water with a pH of 9 or 10, by the time it passes through your lower gastric sphincter, it'll be neutralized, and it'll come to 7.4, 7.3, because the body does not let the body has to maintain the physiological pH in a very narrow range. So even if you drink water with high pH and alkaline water, and that will come to very quickly. As soon as you drink it, it will come to your body physiological pH of 7.2, 7.3 or 4. Okay, so I do not, I don't know. I have not been convinced of this alkaline water. So there may be a benefit. I probably need to learn a lot, learn more. But as of now, I do not see any benefit of taking alkaline water. But yes, you need to have minerals in your water. If not, you need to add a proper mineral supplement to your regimen.
Thank you, brother.
All right, I think let's take just last 3 questions, and we will end the session. Okay.
Yes, doctor. Brother Srujan. Okay, brother Bimor Masia.
Yes, praise the Lord, brother. Praise the Lord, brother.
Yes.
Actually, Murli Anna suggested me to join this meeting.
Yeah.
I have one question. We got married past 10 years, but we don't have baby blessing. So, please
Okay,
suggest.
Srujan, have you listened to everything that I said?
Anna, this is Bimor.
Oh, Bimor. No, Srujan. Just a minute. Hang on.
No, it was Bimor who shared, doctor.
Oh, who asked
Brother
for this
Srujan
question?
did
Okay.
not. Yes.
Okay. So, Bimor, yeah. Have you listened to everything that I said just a moment ago?
I have joined after some time, but not for nothing.
So, when did you join? So, you did not listen to the whole session, is it?
Yes.
Okay. So, yeah, what we will do is, be in touch with Brother Murali, and I will talk to him. And yeah. And also, have you started any of these changes? Have you started any of these corrections that we recommend?
No.
Okay. Have you gotten your vitamin D level tested, checked, both yours and your wife's?
Not yet.
Okay. Please do that. Okay. Ask Murali, and he will tell you what tests that you need to do. Okay. Please get them done, and we will talk. Okay.
Sure.
Okay. Thank you.
Thank you.
Sister Kavita Venkat.
Okay. That is the last question that we will take today. Okay.
Myself Venkat Narsingh Rao. I actually am
Yes.
20 days I'm listening to your session almost every day. So I have diagnosed, I have been undergone CABG heart problem in 2014 and got bypass surgery. Right now my creatinine levels are 1.9 and fatty liver and also glaucoma I have. So I have tested D vitamin as well as fasting insulin is 193. I don't know why it's showing 193. And
No. Is it fasting sugar or fasting insulin?
Fasting sugar.
Okay.
25
So fasting sugar is different from fasting glucose is different from fasting insulin. Okay.
No, what you said, I have done same correction, sir. Same testing I have done.
Okay,
Fasting in
okay. Yeah, did you share those reports to anyone?
Shared these reports with Madam Uma. So she has advised me to take D vitamin as well as K2 and
Okay,
thiam. So I
okay,
have using these things. Also, I have corrected. I'm also using the food changes I have made. I'm
okay.
taking eggs and meat, and I'm trying to correct myself through food only. But most of the time, I'm using the. I mean, D vitamin is 120. I have my test reports, and
It doesn't
HAB.
matter. Don't worry about that at all. That's fine. But still, you need to take maintenance dose. Okay.
Okay.
All right.
So maintain
Okay.
98
What
and
is your question? What is your question?
is actually I've gone. My creatine levels are 1.9. So I want to focus on this and fatty liver. These two things. How to? I mean,
Okay.
correct.
Okay. Fatty liver, there are, please listen to the next week's session also. And we will,
Okay.
if your fasting insulin level is high, you will not be able to get rid of the fatty liver. Okay. And also if your creatinine level is 1.9, and how long, for how long has it been that high?
It is like 6 months.
For 6 months. And you started using these corrections about 20 days ago.
Yes, sir. Exactly.
See, the problem is you need to be clear as to how, in your questioning, because you are giving the impression to everyone who is listening to the question, that your creatinine has gone up in these 20 days. So yes, if your creatinine has been 1.9, has it been stable at 1.9 or has it been going up or going down?
No, it is stable.
Stable. Okay. What was the reason for that creatinine being that high?
No, sir, I didn't know
What
the
were you
reason.
diagnosed with? Did you see your nephrologist?
Yeah, they gave me this not a nephrologist. I met my doctor consultant who has advised me to take few tablets like CKD maintenance, but I did not go to nephrologist.
Okay. All right. So yeah,
So,
you need
kidney, in the
right.
urinary bladder, the stone was formed. It has come
Uh-huh.
out itself.
Okay.
Due to
When
that,
was the
actually,
last? See, these are the things that we didn't want to address, the specific questions, but since we already started. So when was that kidney stone? When did you excrete that kidney stone? How long ago? Hello.
3 months ago.
3 months ago. Okay. And has the creatinine level come down since then, or is it still 1.9?
It was two actually. It came down to 1.8. Again, it has raised to 1.9.
Okay. And how many doses of the vaccine, COVID vaccine, have you taken?
Two doses.
Okay. Okay. All right. I think so. You definitely need to see what is going on with your kidneys, because go to a nephrologist, get a proper diagnosis. Okay, because we cannot guess what is going on with your kidneys. Let them take a look at it, and just instead of taking tablets for CKD I think you need to be properly evaluated. Okay, so continue doing what you're doing. Okay, so do you see any improvement since you started on this?
Yeah, I feel better because after taking these vitamin corrections, I'm feeling better. Like my
Okay.
body I was getting pains in the body, and
Okay. Yeah.
those things come because of the medication.
Okay.
I mean,
Okay.
medication.
All right. Okay, that's fine. That's good. How much water do you consume daily?
Like 3 to 4 liters, sir.
Okay. All right. And so all 6 months you have consumed that, or in the past 20 days?
After before just 20 days back, I only started.
Only 20 days. And prior to that, what were you taking?
Taking like 1 to 2 liters, it was maximum.
1 to 2 liters, because you're told, because your creatinine is high, you should reduce your water intake, correct?
And diabetic also, no? So they told me to
Okay.
limit this water. The
All right.
changes also was taking
Okay.
hydroxy, and I mean, that also they stopped.
Okay, now you tell you add one more to the mix. You are a diabetic. Okay, so yeah. So these are the things that just you need to. So did you listen to everything that I said just now?
Yes, I listened to you.
Okay, just follow that pattern. Okay, and within 2 or 3 months, you should start feeling a lot better. In the meantime, go see a nephrologist. Okay, let's whether you follow what they say or not, or that's a different issue. But nephrologist, properly qualified nephrologist, can assess your kidney condition and give you a diagnosis. Okay, you need to get the diagnosis first. Okay, please do that.
Okay.
And while you're following these recommendations. Okay.
Definitely, sir.
Okay, thank you so much. And yeah, I think we will end the session. Yeah, go ahead, Sister Revati Bose.
Okay. So all those who have joined in new, in the chat, you can see the WhatsApp link. Please click the link and get yourself joined to the WhatsApp group, right? It is very important. Another thing is you have to regularly join the Zoom calls, right? So that you can equip yourself with the right knowledge as Dr. Banu is teaching every day on different topics.